Hello. In this episode, I spoke to Professor Mary-Louise McLaws again, and I asked her whether we know the full spectrum of COVID-19 related disease and whether we're actually counting cases appropriately. If we're only counting severe cases who come to hospital, how do we estimate the total? Do we really know the full spectrum of disease severity, ranging from sort of asymptomatic to mild and symptomatic to needing to be admitted to hospital to needing intubation, ventilation, etc.?
Yes. Well, first let me talk about it in comparison to, for example, flu. So if you have a mild case of COVID-19, you may recover in 2 to 3 weeks. If you have a severe case or a critical case, you can take up to 6 weeks to recover. That's unlike the flu. So we have to remember when we go, oh, it's a bit like the flu, or, the flu is worse. The recovery for flu can be faster if you don't have complications, as you know, as a physician. But what we don't know is when we look at the figures that are given to, say, Johns Hopkins or WHO, there are a lot of things we don't know. For example, the death rate, that doesn't tally with the number of supposed severe and critical cases. So are they in the mild cases, or are the authorities not collecting those data, that important information, and giving it to the authorities? So we don't know that. We don't know the importance of the pre-symptomatic. So WHO don't refer to all of the people that previously were referred to as asymptomatics, because China has identified that 75% of the asymptomatics actually went on to get symptoms. And the reason that the pre-symptomatics were found early on is because they tested family clusters of cases, and of course there were many that tested positive but weren't reporting symptoms, and they tested early before they started to get the symptoms. Do we know how important the pre-symptomatics are? No. Most of the studies, and there has been one from Singapore, one from Washington, a long care facility that we would probably consider age residential care, and then many cases from China, have reported these but have not necessarily looked at other exposures, potential exposures. So they've looked at like a cluster and gone, well, we've got pre-symptomatics, are they the cause? Are they driving it? And in Australia, they don't seem to drive it, because from an epidemiological perspective, if they did drive it, we'd have many more cases of community spread that have not associated with the international cases. So we don't, but we still need to know more about them. We need to know and understand the pre-symptomatics and the mild cases, how they are dealing immunologically wise with this disease compared to the severe cases. Do they not have any hypertension? What is it about them? And the pre-symptomatics, are they only in young people, or are they on people on, say, Panadol or something that keeps the temperature down? And sometimes people, as you know as a doctor, don't recall a symptom, and it could be mild. And they could be used to aches and pains because they've got arthritis or something else. Has somebody not asked them whether they've lost their sense of smell or taste early on? So there are many things we still don't know about them. We don't know the asymptomatics because China hasn't come back with that 25% that were missing from all of those groups that were supposedly labelled as asymptomatic. What are they about? Were they false positives? Were they real positives? Are they young? So we don't know a lot. So there's a lot about this new novel disease that we don't know.